Ghana has confirmed 21 new MPOX cases, bringing the total number to 467 as of August 28. According to the situation report released by the Ghana Health Service, death remains one with no admissions. All 16 regions have recorded cases of the disease so far in the country, raising continuous concerns about the increasing number of cases in the country. Authorities are yet to say when the vaccines will arrive in the country for the vaccination campaign to begin. And I'm joined by the Greater Accra Regional Health Promotion Manager at the Ghana Health Service, Eunice Juan Tay Chagli. Thank you for joining us this afternoon. Now, first, the last time we checked with our sources, Accra had recorded 127 cases. What's the current situation in Accra specifically?
Thank you, and good afternoon to your cherished listeners. We are grateful for the opportunity to sensitize the public once again on the fight against MPOX. As we speak, the cases confirmed in Greater Accra, it's now up to 139 by the last update, and it's still ticking. And usually, we always say that the numbers we have at the facility are just the tip of the iceberg, cases that have been reported. So if the service is able to pick up 139 cases confirmed, then it means we have more in the system who have not yet reported into the system. And in Greater Accra now, we have 24 out of the 29 districts confirming MPOX cases. Thank you.
Right, and so this means that out of the 139 as of today, it's possible that there are many more out there because they have not come for testing or they have not reported. We're unable to account for these numbers, correct?
Yes, that is exactly so.
Okay.
That's exactly so.
Okay, are most infections...
Because when you look at the engagement at the community level, you realize many people are attributing the condition to taboos and many other misconceptions. So some people are refusing to report at the facility, which is of great worry to the service and to the security of mankind in general in the country as well as outside the country.
Okay, are most of these infections localized to specific communities or there's a wider spread?
Thank you. It's wider spread. And the reason why we will not say they are localized is, of late, we have a lot of mobility. People wake up in one community and they are working in another community. Some people can move to 3 districts in a space of 1 day. So in that case, we cannot say if a case is here, it means it is localized here. Secondly, from some of the districts, even the cases confirmed in some health facility at particular districts, the people reside in different districts. So it is spread all across the region and then the country as a whole.
What's the update you can give us on vaccines? Have we secured any at all?
Thank you. In terms of vaccine, I will say let's hold on that. One, if you bring vaccine now, it becomes another ball game for you to convince people to come for vaccination. So we should be talking about what can we do as individuals to protect ourselves and protect our loved ones. You know the hassle we go through to get people to accept vaccination. And we have experienced that, and it continues to be of a great concern how we are rejecting vaccination. However, we have a lot within our means that we can do to prevent the spread of the disease among us. So if we can look at that, that will be of a great help. And if that is done, we may not even need the vaccine at all. So we need to do the things that we need to do. We know it's a disease that is zoonotic and it's spread from animal to human beings and from human being to human beings. And none of us were expecting that we'll get to this level and by now the curve will not be flattening. So it means that we have not done the best as individuals to ensure that we break the chain of transmission. So for us to break the chain of transmission, we should be looking at how do we interact with people in our environment. Now, when people are even positive and you want them to give you their contact to follow up so that we can support them, let them understand that there is the high risk of them having contracted the virus, and they need the support to monitor and ensure that they live a life that do not put themselves and the people around them at risk. It is becoming an issue, and that alone is a lot of issue for us to deal with. So we think, one, we should be ready to help ourselves by allowing the system to follow up on the people who we interact with, especially those of us who become positive.
Okay.
And we should know that when you are positive and there's somebody mention you as a contact, it's not something to stigmatize you, but it is to help you to ensure that you do what is expected to protect yourself and the others around you.
But do you have resources? Do you have resources, at least, to handle the rising cases? If I hear you, it's as if the vaccines are not the major need for you. Do you have resources to handle the other matters? Do I still have units? Well, unfortunately, we don't have units. Well, okay.
We pick up the case, follow up on contact, stigmatizing people about. And we need to ensure that we wash our hands as frequent as possible so that we are able to break the chain of transmission, which is very important at this time.
I'll try again, Eunice. Can you hear me?
Yes, please.
Okay, I'll try again. Do you have resources to handle the current rising cases?
Thank you. The system has this.
Unfortunately, the network is not very kind to us.
If the private sector...
We'll try and bring this back in our subsequent bulletins. Unfortunately, again, I'll try again. I will try one last time again. If you can hear me, I am on the resources. Do you have resources to handle the current situation?
Hello?
I can hear you.
Can you hear me?
Yes, quite clear.
Can you hear me?
Yes, quite clear.
So I'm saying that resources are limited, and it is a call to the private sector or all of us to support in the resource mobilization and ensure that we have sufficient to be able to work with so that we can reach out to every situation that we need to reach out to and the needed resources that are for the people to move out there and do the work.
Right.
So resources are welcome for all individuals, and then the corporate bodies to help all of us fight this condition because it entails a lot, the management of the cases. And we all know that there are no charges when you are confirmed. The treatment is free of charge.
Okay.
There is the need for logistics to follow up or contact and ensure that they live the way it's expected so that in case they are positive, they don't put others at risk. And even those confirmed and have been treated do not expose themselves for reinfection. And all this needs resources to manage. So the corporate body is welcome to support the government supply of resources.
Thank you so much for joining us today on the news. Thank you. I'm certain that we've heard you quite clear. Thank you so much. Now.